Hello viewers, welcome once again to our Faforlife Health Talk series. Today I'm going to be sharing with us what hypertension is. Hypertension is a medical condition where the force of the blood against the walls of the blood vessels is consistently too high, resulting to damage to the heart, the kidneys, the blood vessels themselves, and a lot more other organs. I want you to understand that hypertension is the major cause of premature death globally. I mean worldwide. That means approximately 1 out of every 4 men have this hypertension. 1 out of every 5 women have this hypertension. So let's talk about the types of hypertension. We have the essential hypertension. We can also call it the primary hypertension. This is a kind of hypertension that do not have an identifiable cause. We can't actually trace what is actually causing this kind of hypertension. I want you to understand that most of the time hypertension can be asymptomatic, where there is no display of symptoms. You're feeling fine, but you're actually hypertensive when we try to check your blood pressure. So this essential hypertension, sometimes we can trace the cause to genetics, lifestyle, diet, and age, but in its true form we don't know its cause. Let's talk about the non-essential hypertension. This is another type of hypertension. It can also be called a secondary hypertension. This kind of hypertension have an identifiable cause. Now, some of the things that may cause this are unhealthy diet, persistent inactivity, alcohol or tobacco consumption, being overweight or obese. You see those people who are having excessive weight. We have family history of hypertension. We have things like age as well. We have coexisting diseases or disorders like kidney disease, diabetes, and all of that. Now, the third kind of hypertension that we have is called the isolated systolic hypertension. In this kind of hypertension, recall that the normal blood pressure is 120 over 80 millimeter per mercury. This is the normal blood pressure. Okay, so when the blood pressure, this normal blood pressure, remember the figure above is called systolic, the figure below is called diastolic. Now, when this systolic is becoming 140, driving too high, we cannot target to be isolated systolic because it is quite very high over the normal range. So when that occurs, it is called isolated systolic hypertension. We also have malignant hypertension. We also have resistant hypertension and all of that. So there are signs and symptoms that actually follow this hypertension if there is a noticeable change as regards to this hypertension. One of the signs and symptoms could be early morning headache. When you wake up, you begin to feel unnecessarily uncomfortable as regards to headache. Another symptom could be nausea, vomiting, confusion, chest pain. Sometimes you could even notice buzzing in the ear, your ear making some kind of noise. Sometimes when you walk, you begin to have sound, hearing your footstep. We call it palpitation, and several other symptoms that may be associated with hypertension in itself. There are ways with which we can actually treat this hypertension. Now, one of the ways is ensuring that you are able to manage stress. Just like I've said some time ago, that you cannot stay away from stress completely, but you can actually manage or curb it. If you don't do that properly, on a long run, it could lead to hypertension. Another treatment is medication. Now, we have several medications, drugs. For example, the beta blockers, we have diuretics, we have the calcium channel blockers, we have the angiotensin converting enzymes inhibitors, we have angiotensin receptor blockers, we have the vasodilators, we have the central agonists, and many others. So these are classes of drugs that can actually ensure that hypertension is improved. But another way by which we can actually manage hypertension is the use of supplementation therapy. This is quite organic, using organic dietary stem cells, and we have several products as regards to these organic stem cells that can help manage this hypertension. One of it is Salute, another is Faforlife, another is PDX-19. Now, Salute and Faforlife in them contain some of the active ingredients that can help to manage this hypertension. They especially active ingredients like the Kaya family. You see, in the Salute we have the Kaya ivorensis, in the Faforlife we have the Kaya grandifoliosa. These major active ingredients have the ability to ensure that the hypertension is quite managed and ensuring that the blood pressure is brought back to normalcy. Now, the SpeedX19, in it have another active ingredient that can as well improve blood pressure. Now, one of the active ingredients in this SpeedX19 have what we call or contain eugenol. This eugenol in itself have the ability to dilate blood vessels. You know, when I talked about the non-essential hypertension, where the causes are quite identifiable, unhealthy diet could result to, for example, atherosclerosis. We call it deposition of fats in the blood. Let me use that as an example. Now, once there is deposition of fats in the blood, one thing you will notice is that the rate by which the blood flows in the blood vessels changes. There is no normal flow of blood that is being supplied to the heart anymore. How? As this active ingredient of SpeedX19 that has this eugenol ensures that if, for example, the blood vessels are stiffened, because once they are stiffened, the rate at which the blood flows increases, thereby increasing the pressure on the heart. What the eugenol does is that it ensures that this blood vessel relaxes, so that the amount of blood that it carries, the level or the rate by which the blood flows, becomes normal. Now, another thing I want to bring to your attention: if peradventure you have a patient that is on antihypertensive drugs, do not stop them immediately. Do not tell them to discontinue the use of those medications instantly. Why? It could result to hypertension rebound.